Hello and welcome to this very special show featuring Cadila Pharma in conversation with ET Now. My name is Sumit Lakhotia and I'm in conversation with Dr. Rajiv I. Modi. He's the Chairman and Managing Director of Cadila Pharmaceuticals Limited and a number of group companies. Dr. Modi, thank you so much for taking out time and talking to us today. So I'd like to start off first getting your view on the pharmaceutical industry, specifically in India, and then maybe Cadila's role in it.
Due to the pioneering work done by various predecessors, doyens of the Indian pharma industry. My father was one of them. India has become one of the most recognized, respected quality and affordable price supplier of medicines for the people of the world. And that has happened because of a lot of hard work, not only by the people who have promoted, built the industry earlier on, just post-independence, but also with a very responsive support in terms of policy by the various governments over time.
And so, Cadila Pharma has played an iconic role here. Like you mentioned also, your father is an industry legend. Just a little brief look into the history of Cadila Pharma and the role that you feel has been played in.
So, if we start post-independence, Cadila was one of the pioneering companies to make medicines in India. At that time, post-independence, it was always Angrezi Dawa. And in that era, where Cadila became a household name of make in India at that time for pharmaceuticals. So ever since that time, Cadila has been in the forefront. Cadila has been a very well respected name for the medical profession, because a current young practitioner's father's father may have met my father when they were initially building the Indian pharma industries to keep India's population safe and healthy. So ever since that, Cadila has jumped multiple roles, responsibilities, and I'm very happy to share with all of you. We are a private company. We are among the largest pharmaceutical private company in our country. It's solely held by the family.
Now I want to talk to you a little bit about leadership. So what would be, you could say, your leadership philosophy, and what would you say maybe some of the important challenges that you might have faced, anything that comes to mind?
So it's a very interesting question, and I think leadership, my leadership has evolved over the last 20 plus years, ever since I've been in the company, starting from, very curious, very participative, and as you mature and get wiser and get feedback and listen to feedback, it's been more of participative, encouraging professionals, both young and mature professionals, to take frontline roles and be the face of the company.
That's very important, very wise words. And I love the part which you said about how it evolves, because change is the only constant. Carrying that change on is where innovation comes in, because innovation also brings in this most required change, the research, the R&D. If you could give us insights into the importance of innovation and R&D at Cadila, what are some things happening there?
So I'm very proud that, I'm very happy first of all that you asked this question. Pharma is absolutely hand and leg and body connected with innovation. Although in our part of the world and among the Indian pharma industry, and we're talking specifically of India, we are mostly generic product suppliers. So innovation has not been, innovation has been to the extent across, I would say, in Cadila and across, in terms of how to make the product of the reliable quality, how to build processes to make sure that the products are safe, are of the highest quality, approvable by the recognized drug authority. Well, we work a lot on innovation. But the good part is that we have been successful in launching multiple products over time, which have had global recognition. So I'll give a few examples. Initially, we had a product which was a combination of drugs. This was recognized, it is now recognized after such a long time by WHO as one of the most critical medicines, as you may be aware of now. And over time, it has been appreciated because it causes and brings about a good outcome for population around the world of 40 years and old, as we talk about. We also did pioneering work in the area of tuberculosis. And then we have evolved beyond just molecules and spent a lot of effort, lots of resources, and with pioneers to bring the first recombinant flu vaccine in India and the world. We are pioneers to bring the first 3-dose recombinant rabies vaccine in the world. And these are all approved products. And likewise, we have a multiple vaccine and biological pipeline, which will bring new vaccines, latest generation vaccines for the people of India and the world.
Fantastic. But that's the beauty of it, to keep innovating and keep helping the community. So you spoke about a couple of vaccines, couple of products that have been approved by the WHO also. So obviously Cadila Pharmaceuticals has a global presence also. Yes, yeah. How has that been? I mean, how as a leader have you been able to manage things in international markets as well as India? Because the regulations are very different abroad compared to what India is.
You've asked the right question. Cadila is a diversified company. So we have various accomplished professionals with a lot of experience in different areas of business. And it's basically a collective teamwork, building a good, competent group of professionals who believe in the vision, mission of the family and Cadila, which is to provide the best quality but appropriately priced product for the population of that market. And it is this joint teamwork of professionals, both men and women, which work with me. And together we have made that a step of selling product of Cadila brand name, not only in our country, but also in different parts of the world.
So in a pharmaceutical industry, in a pharmaceutical company, partnerships, collaborations are really important. If you could shed some light on some collaborations, some partnerships that Cadila Pharmaceuticals has in place to just show the growth of the company, the way ahead for the company.
So personally, I've been very, very open to learn from others. So we have had over the period of the evolution of Cadila, we have had relationships, partnerships, alliances, collaborations with academic institutions when we thought they would add value to the technology progress at Cadila. To the extent that now, over the last 5-7 years, Cadila, as part of its various outreach programs, has established a university. So we have now more than 1,000 students at our Indrashil University, a CSR activity, an initiative very fond in the hearts and minds of my parents, actually operating for the last 7-8 years with more than 1,000 students. So we collaborate with our university and the faculty there. But likewise, we've collaborated with faculty and academicians within our country and around the world. So to bring in newness in what's happening in the world. Apart from that, we collaborated with technology providers. So for example, initially we collaborated with a pioneering company which was interested in virus-like particle-based technology for vaccines. In fact, we even invested in that company, and then of course we exited. And that's what brought us this technology in the vaccine pipeline to bring the new generation vaccines. And likewise, we have collaborated with academicians who have been in the top league in their areas of research. So it has been various sort of collaborations. product specific, and ultimately then, you know, they would bring in technology, would collaborate, help us, and then we.
Because it's great, because I personally believe so that, you know, many hands that come together bring out better benefit, and that's what the aim is, to always be able to benefit the public more and more. So one important part, we spoke earlier about innovation and R&D, but the role of technology and the digital world, because that is also vastly and quickly changing. So any thoughts that you have? How are you implementing digital and technology changes at Cadila Pharmaceuticals?
So we've, as a company, we keep on investing to improve ourselves, try and attract, source, assimilate new technology. Technology doesn't come free, so we put investments to ensure whether it's manufacturing technology to have reliable, high quality product. Really, so we put a lot of effort on that, and that's why pharma industry is not a joke. It's a very rigorous industry. Manufacturing reliable product is very expensive, and so one has to ensure that by efficient use of resources and scale, one marginalizes, one puts all this high expense, but still make the product expensive. So it's a very tough industry.
I'm sure, and of course the regulatory pressure, and of course, like you've been saying, the impact on people's lives. So it's very very important, but very an industry that needs the minutest of attention to detail. So I want to talk to you about some of the CSR initiatives. You spoke about the university,
over time, and before CSR became a word which is commonly used these days, for multiple decades, my parents always believed in giving back. And when Cadila was very small, my father established a rural medical center in the state of Gujarat, in the area near Ankleshwar and Bharuch, in a town called Hasot, where he was born and brought up. So ages, 40, 50 years ago, we put a charitable institution. And we've done that now across various parts of the state. And today I'm very happy and proud that our CSR team in this whole area of working with the government and with the local people to help better life, work in more than 50 villages in various parts of our city of Gujarat, where not only do we make sure that the health is taken care of, good health, participate and work with the government institutions, but also economic benefits, seeing how people can earn better, seeing how farmers can produce products which are going to give them higher yield, higher returns, ensure that how within the villages the cattle are more productive, so that the men or women of the family not only have enough supplies for themselves, but also can get extra income from the cows and buffaloes that villagers provide. To rural sanitation of women. India is a developing country, and I'm sure you've been around long enough, and there's so much talk, but there's so much to be done. And Cadila, through its CSR initiatives, tries to help partner with the local villagers and villages to bring about happiness and upliftment. And we are very happy that we get very positive response. Our group of people who lead the CSR initiatives have been applauded at various forums because of the work. Although we don't publicize, but people have recognized the good work, and they come back and encourage them to do better.
That's heartening to know, sir. That's very nice to know. Let's talk a little bit about talent, because earlier also in our conversation you were mentioning about talent. Now, especially in the pharmaceutical industry, talent A is highly skilled, B is really important. So how does Cadila Pharmaceuticals both attract and retain top talent?
So we've been very fortunate, I should say, that I guess because of all the good work that we're doing, people have a good impression about Cadila generally. And so attracting talent has not been such a challenge. But as the company grows, as the ecosystem of our country changes, we have adopted various approaches. I wouldn't say policy because policy is not. Various approaches to attract, retain, nurture talent. And so starting from the very basic that we would attract, and that's a flavor of Cadila for some time now. We like to get bright, fresh, young college graduates, men and women, and induct them at the lowest level. And it has been my endeavor to encourage my team to see how we can have people join in earlier on in their lives and over decades graduate, get promoted and become better. And I think I'm so happy to state with you that if I look at the population of the people of more than 10,000 directly employed people, there are many people in our company who have spent more than 2 decades. And those have joined wherever they join, but are among the leadership team. Many of them are among the leadership team. So today there are colleagues who are heads of businesses, heads of departments, leading an initiative as a cross-functional team who have been working in the company when I joined. So I think we have a blend of that. And also, of course, we have a blend of young people, new people. You know, it's a dynamic world, and I'm not trying to say that everybody in the company has been for 20 years.
That's great to hear, sir. So like you said, CSR was something that Cadila Pharmaceuticals was doing even before it became cool to do CSR. And another thing I believe could be the diversity, inclusion, equity changes that have come about. Because if my statistics, if my research is right, I believe when founder chairman sir started the company, the first employee was his wife, your mother. So mother. Equality, diversity, inclusivity was there. How has it continued? Can you tell us what else is happening at Cadila Pharmaceuticals in that space?
So I firmly believe, and as we all see, the social dynamic of our country has changed over the decades, and today men and women are equal. They were always equal, but are now it's more recognized that they're equal. So appreciating that evolution of the social dynamic of India, we at Cadila also encourage both men and women. So we're talking of diversity, we're talking more girls and young girls and women to work in our company. And therefore the rules ecosystem of our country, of Cadila is adjusted to make the workspace acceptable and encouraging for women. So whether it's our factories, in whichever locations, or it's our offices, we've recognized what is required to make women participate actively. I mean, we have a lot of women who are now heads of departments. So it's not only just the fact that we have a diversity, we have a ratio of men and women, but also we have people who are not only recognized and they are in a leadership role in our company.
So shattering the glass ceiling, as they say. So one last question before I let you go.
But we never talked about it. So it has become, it was just natural. So when you hear all this, oh, women and all that, we've been doing it for decades now. To the extent that there are these people who are, I mean, there are people, I don't want to get into that detail, but who have reached not only after they retired, we have asked them to join our board. Oh, they've been so successful in terms of nurturing, and they know the pulse of the company. So we have people who worked in the company for 25, 30 years, retired, and now are independent director on the board of Cadila and various group companies.
Fantastic. So one last question before I let you go. The future. What is your future vision for Cadila Pharmaceuticals?
So I would say, that Cadila is like I said, it's the largest privately held company. We continue to stay private. My son is a very enthusiastic young man, still studying, but experimenting with life and experimenting with various ideas. He's a wonderful colleague of mine and very much involved in whatever I do. Knows equal, I would say, even I would dare to say he even knows more about what's going on in the company, and we have wonderful conversations about various aspects from what's happening on a day-to-day basis to what Cadila should be, and always nudges me with this question. So I think Cadila is at a very nascent stage, I would say. Yes, we've gone through 70 years and so on, but I think we have created a wonderful platform. Cadila is ready to catapult, and I think over the next some time, I think our market reach, our reach of products should only multiply in terms of double, triple, and so on. So that's the stage which we are in. It's a very fascinating stage because I can see that happening, and I can feel that over the next years, this whole team of colleagues of mine who are very dedicated, very devoted, and very loyal and committed to the principle of what Cadila is. Together, I think we're all going to take this company to a next level and continue to stay private.
Fantastic. Well, Dr. Modi, it was a pleasure having a conversation with you. Thank you so much for your time. All our best wishes to you and the entire team for the way ahead. Thank you so much for talking to us.
Thank you very much.
Thank you for watching this very special episode featuring Cadila Pharmaceuticals in conversation with ET Now. Thank you so much for watching.